I want to briefly hit on mental health medications in regards to what you read online because there is so much information out there now that is saying, for example, oh, mental health medications, psych meds, they cause this, this, and this, these side effects, right? Which, don't get me wrong, on some people, side effects happen. That can happen to anyone. But don't let that don't let that detour you away from potentially starting a medication that your doctor wants you to potentially take, because everyone's anatomy and physiology is different slightly. There are people who respond really well to antidepressants, and there are others, as we discussed, that do not. That can have things such as sexual dysfunction, that can have really bad suicidal thoughts. It can be really hard for them to get off of the medication long term. These are all true and they should be made aware, but you get a lot of people out there that, reading that there are people out there that does happen to, then they think that nobody should have the option to having these medications like SSRIs or even, ADD medications, medications for schizophrenia. And don't get me wrong, if somebody is doing better without medication, that's amazing. That is the best thing. But what you're starting to see is people taking a stance of no, there should be no mental health medications on the market, or that's all everyone should be consuming. The problem is there needs to be a balance that needs to be established. Meaning, you can read things on even Reddit, on just the internet in general, that will give the side effects, and you have every right, obviously, to know about the side effects of specific medications, obviously, and you should be educated on them. But if you're struggling with something such as anxiety or depression, and the doctor recommends a medication for you, don't become just a skeptic over it. They're doctors for a reason. They are medical providers for a reason, and it could be the medication that changes your life for the better, not the worst. That, unfortunately, a lot of times there are people today that they're all in one way. And I want to let everyone know, just on this channel, just so everyone's made aware. Yes, I have worked in mental health as a psychiatric RN. Do I support medication being administered? Yes, 100%, because I see sometimes the sickest of the sick patients that are in psychosis, that are going through a major depressive disorder where they can't even get out of bed. I'm talking like catatonic patients who can't get out of bed. Bipolar disorder, people can't emotionally regulate their moods at all. And you'll get people who will say, oh, they just need the therapy they need. That's true. But that's not just going to happen overnight. There needs to be a whole healthcare system change for what's being promoted about, oh, we just need therapy and no medication. I believe that there's a balance. I don't believe in over-medicating, but I also at that same time believe that medication is extremely crucial. And we should continue to, for example, approve different medications, because as we continue to evolve and humans continue to evolve, over time, medications might not work the same way. I mean, if you've been taking, for example, even an SSRI for years, sometimes you got to make a switch besides just upping the dose. That's why we need to continue to have more testing on different types of antidepressants or anxiety medications. And yes, I agree, benzos should not be prescribed for somebody long-term daily use. I 100% agree. But they do have their spot for people who need them as needed for severe anxiety and sometimes for sleep. There have been studies that have shown that that they do help people when they're going through crisis, that they do help people at night to go to sleep and as needed during the day, short term. Now, at that same time though, remember, things such as Xanax, Klonopin, Valium, Ativan, these medications, in my opinion, they should obviously stay controlled, scheduled medications. but limiting the access to a point of where they're not available to people anymore. And this isn't even just from a money perspective. That's just outright stupid. Stupid. It's stupid because if these medications were not prescribed anymore, think about the people that are currently taking them. You cut people off, and I understand, for example, like the opioid crisis, which they're trying to get that under control, but the way they're going about it by just cutting people off of medications all at once or lowering their dose dramatically, that's messed up because there's stroke victims who need it. I've got a family member, a grandma who had a stroke before I was born, who's been taking medication for pain for the last 30 years. Messing with her medication, that's just wrong. She obviously would have a tolerance to it, but they shouldn't be like cutting medication. That's my problem with a lot of times just this all or nothing approach. But things such as I said, like benzos and whatnot, you cut people off those all at once, seizures, and somebody could develop seizures. That's why you would want to taper off of them. But they have uses for people who need them in the meantime. For, let's say somebody passed away, let's say they're going through a crisis. There need to be medications there for patients. So I believe there should be a balance between not overprescribing, but not underprescribing either. And don't get fear-mongered into seeing some of these channels who just promote side effects. Like I'll go over, for example, with SSRIs and all medications, common side effects, but that doesn't mean that I'm against medication. I am for medication. I'm for a balance of medication and holistic medication. There's a fine balance between the two. So I want everyone to know that now. So when I talk about side effects, that doesn't mean, I think this medication is bad, or the other way where I'm saying, no, I think it has its uses. I'm not somebody who's going to be taking a stance one way or the other, because medications are needed. In the future, hopefully, I do plan to become, for example, maybe a nurse practitioner or something. But the reason why I say that aspect of it is because for anyone who's a nurse practitioner or even nurse out there, you have to keep an open mind both ways. You got to be receptive to medications that can cause potential complications and medications that do help patients, because there's an objective aspect, but it's also, medication can be very subjective from one patient to another. So I just wanted to clear that up. Be very cautious what you even look at online. There's even some doctors out there that claim they're completely against all medication. And I just think that's wild. It's like you're a doctor and you're against all medication. Just remember, if you see something like that online, if they're against all medication, there's probably some other incentive in there. Just letting you know that. There's always an underlying cause on why. Just always be cautious. Be very cautious with that, because medication is very beneficial, and at the same time, there are, as we stated, side effects. So just find that fine balance. When you're online, read both ways. Find channels who talk about side effects, but also talk about benefits. Yes, drugs do cause. There are medications that can cause or offset addictions. Also, being a human, as we are, if you take something long term, you will naturally, with our physiological responses, will develop tolerances to medications, which is different than addiction. So just keep stuff like this in mind. Find that balance, because if you're completely one way or the other, regardless of the circumstances, that's going to get nowhere in the future. Love you all. Check out all my mental health videos. I cover pretty much everything. Have a great week. Leave a comment if you've been affected by medication or if medication's helped you in some way, in particular psychiatric medication. All right, I'm out.